Gambia's Minister of Health Friday disclosed to journalists that it will be embarking on a nationwide COVID-19 vaccination from the May 9 to 15, 2022. During a briefing at the Health Promotion Directorate in Kotu, the ministry says vaccination is targeting people from 12 years onward, and the vaccination team will be roaming the town whilst others will be stationed at health facilities and strategic locations like ferry crossing points, village bantabas and schools. Mafuji Sise reports.
Funded by WHO, UNICEF and World Bank, the Gambia received lots of AstraZeneca vaccine, COVAX, Johnson & Johnson vaccines since the outbreak of the deadly pandemic. Aja Kande Jallo, the ministry's communication officer, expanded on the program on immunizations.
Aim of the vaccination in general is to reduce morbidity and mortality due to vaccine preventable diseases. We know we have a list of vaccine preventable diseases, especially among children. We have the polio, we have the measles, we have the meningitis, and now the COVID has been included in the list. And it is affecting almost all the population. And this is why we are not limiting to children and mothers or childbearing women, but we are expanding to the general population. And our goal is to reduce morbidity and mortality.
Countries around the globe close borders, introduce face masks, social distancing and sanitizers, and impose curfew on their populace to cope the spread of the disease before the coming of the vaccine. Modun Jai, Director of Health Promotion Directorate, reiterated the call for compliance.
Appeal to the general public that the vaccination teams will be moving as a team. Some of them will be doing the sensitization to inform people about the arrival of the vaccination teams in their communities. So some of them also will also go moving ahead of the teams to also make certain logistic arrangements prior to the arrival of the vaccination team in certain communities. And then we also have the vaccination teams, and they'll be going from village to village. That is at the regional level, and then at the national level here, for example, I would say Canopy Municipality, BCC, and the West Coast region. The same strategy will follow, whereby teams will be going from village to village, house to house, in fact, street to street.
Since the introduction of COVAX, Johnson & Johnson countries have been busy vaccinating their people against the deadly disease. However, this meets up with challenges that the vaccine is not safe and effective. Director Njai has this to say.
We want to assure the public that the vaccines are very safe, very effective, and we are getting information from people who have taken the vaccine that it has nothing to do with their reproductive system. And then, like, for example, people are saying if women have taken the vaccine, they will not have children. We also want to inform the public that this is not the case. And those who have taken the vaccine, and they are females, and then we have seen that many of them have, they are getting children, and the men also equally, those who have taken the vaccine, we have also seen them having children since the vaccination started in this country. So those information are rumors. We want to tell the public, let them not listen to those rumors. Let them also keep on following us on our Facebook page as a ministry, Minister of Health Facebook page, the Twitter. We also have our 1025. Anything that doubts them about the vaccine, let them always call, and for sure, everything will be clarified to them. But what we want to say that most of the rumors that are ongoing about the vaccine, these are things that have been found to be something that's not the case, and that's not real. So we want to let them drop those information, and then and also take our advice. We are also very happy.
Mr. Siddharth Fofana, Program Manager for EPI, says without the intervention of the developed world, he does not know what will happen to poor countries like the Gambia.
Vaccines are highly perishable biological substances, so you need to keep them properly, especially some of these ones. The Pfizer vaccine, it requires a special storage, that's called ultra cold chain, minus 70 to 80 degrees centigrade. We don't have that. But thanks to our government, our very good partners, American government was able to give us very good two large-scale refrigerators as well as the COVAX facility. This is the facility that is put up together in an emergency manner to make sure that poor countries also have access to this vaccine. If that is not done, can you imagine?
Countries around the globe close borders, introduce face masks, social distancing, the use of alcohol-based hand sanitizers, and imposed quote on people just to minimize the spread of the disease before the coming of the vaccine. Since the introduction of the AstraZeneca, COVAX, Johnson & Johnson, countries have been busy vaccinating their people against the disease. This met up with challenges that the vaccine is not safe and effective since it cannot cure the disease. It's the target of the health experts for 60% of every country to be vaccinated, but Africa is not forthcoming. Reporting for Eyeafrica News, I am Mafuji Sise.